This is Dr. David Stoker, board-certified plastic surgeon in Marina del Rey, here to talk to you about dermal fillers. What are dermal fillers? Dermal fillers are synthetic injectables that come in a prepackaged syringe that may be injected just underneath the skin to fill in contours, depressions, wrinkles that are associated with aging. We also have certain dermal fillers that can help to improve the overall shape and aesthetics of the face. Two of the most common injectable fillers are Juvederm and Restylane. They're made by different manufacturers, but they're both types of hyaluronic acid, which is basically a normal component of the skin and all of our bodies. They come in a clear gel that lasts about 6 months. It's commonly injected in this area, in the tear troughs, along the nasolabial folds, into the lips, in the marionette lines here, and then select other little wrinkles, such as along the commissures of the mouth, and vertically in some of the wrinkles on the lips. Each case needs to be highly individualized. One of the beauties is that it's not all or nothing. You can do little bits in stages. You can see it right there as it's happening in front of you. And if you don't like it, you can inject a little hyaluronidase, which will immediately absorb it so that it's as though it was never there at all. Fortunately, it's rare that anybody wants it dissolved. Usually it looks great and is very helpful in improving aesthetics of the face and reversing the signs of aging. We now have some longer lasting dermal fillers such as Juvederm Voluma and Radiesse. Those are useful in deeper layers, such as enhancing the cheeks, not close to the surface of the skin, but a little bit deeper, where you're not going to see the thicker consistency of those gels. That's great for improving the overall fullness of the cheeks and those who have flatter cheekbones, for giving you a little bit of lift here when you're not ready for surgery. I think of fillers as icing on the cake. If you need surgery, such as eyelid surgery or brow lift or facelift, then you need surgery to get the real results. But if you're not ready for that, or if you've already undergone surgical procedures and you want a little bit more, the dermal fillers are a very powerful, low-risk, predictable tool for improving the overall aesthetics of your face and doing it at a relatively modest cost. If you have any more questions about dermal fillers, we'd be happy to answer those for you at our office. Feel free to give us a call. This is Dr. David Stoker, board-certified plastic surgeon, speaking to you from Marina del Rey.